So today we will discuss about the unit that we use for the radiation, and second thing is what are the damage or what are the adverse effect of this radiation, and how we protect what precaution we take to protect ourselves from the radiation damage. And third one is this radiotherapy, how this radiation is used for the therapy of the cancer or cancer treatment, and how this cancer cells behave once get irradiated with the this radiation. So one by one. So first is a unit of measurement. So uh, first is a exposure quantity. How much quantity we expose to a particular subject, or how much quantity of radiation we expose to a particular subject, that is measured with the help of this Ranjan. And that means the unit of exposure we measure with the help of this Ranjan, and one Ranjan is equivalent to the radiation that produced 2.58 into 10 to the power minus 4 coulomb charge per kg in air, because ionizing radiation, so it ionizes and produces this much of charge. Okay, then next one is the absorbed dose. As we know that the different tissue of our body absorbs differently, or we can say the all tissue of our body is not equally absorb the radiant energy. So the different tissue have a different absorption. So how much particular tissue absorbs to a particular radiation, for that we use the unit gray, or before gray the unit was rad. So one rad is equivalent to radiation necessary to deposit energy of 100 arc per gram of irradiated material. And one gray is equal to 100 rad. Next one is the dose equivalent. Dose equivalent is nothing but it measures the damage that is uh, produced in a living tissue when absorption of the same dose in gray from the different type of radiation. Suppose same dose of a different radiation like X-ray, gamma rays, or alpha rays we irradiated, then how much damage that is produced in a living tissue is measured with the help of dose equivalent. The SI unit of dose equivalent is sievert, and earlier this unit was RAM, Ranjan equivalent man. One sievert is equal to 100 RAM. So one sievert is equal to 100 RAM. 1 RAM is equal to radiation rad into quality factor, and quality factor for X-ray and gamma rays is 1, and that of alpha particle is 20. So next part is the hazards of radiation and what safety we take to protect ourselves from the radiation damage. So if we think at the molecular level, then pyrimidine base is more sensitive to radiation damage as compared to the purine base. Next, if we compare our body part, then the cells that is proliferating regularly or more proliferative cells are more sensitive to radiation damage as compared to the non-proliferating cells. Like for example of this proliferating cells is epithelial cells, mucosa cells, germ cells. They are regularly dividing, right? Then non-proliferating cells is radioresistant, like muscle cells, nerve cells. They are not routinely in dividing stage, so they are more resistant to radiation damage. And if we compare the species, then rabbit is one of the more sensitive species for radiation damage, and goat is a least sensitive species. Other species is belongs to the in between these two. Then one this term is LD50 by 30. This LD50 by 30 is different from the pharmacological. From the in pharmacology also we study this LD50 by 30, but here in case of radiation it is a different. So LD50 by 30 in this radiation or radiology is dose of radiation that will kill 50% of the population that exposed with the radiation within a period of 30 days. It's called LD50 by 30. Next one is a death caused by the radiation damage to the hemopoietic system is due to severe neutropenia that permit development of the infection. That means they once the radiation get exposed, there will be severe neutropenia, and due to deficiency of this neutrophil, body system is not able to fight against the external invasive bacteria or pathogens, and there will be a death of the organism or living being. Then, if we compare about the different stages of RBC, then erythroblast is more sensitive to radiation damage, whereas myelocytes is less. Next, when if we compare about the different segment of GI tract, then duodenum is more sensitive to the damage by the radiation among the different segment of the small intestine as compared to the others, right? Then among the different stages of spermatozoa formation, spermatogonia is highly sensitive to radiation damage, whereas the mature sperm are radio resistant. So these are the body tissue at different stages, which is more susceptible for the radiation damage. Then safety devices. If a person who is working in a radiological unit, he is regularly supposed to expose because he is regularly taking the X-ray. So there are safety measures or guideline to follow for the safety of the radiation damage. So the person who is working in a radiological unit must wear the lead apron, and this lead apron is not normal apron, but it is coated with the lead thickness of about 0.25 mm, and he should wear the lead gloves or with a lead thickness 0.50 mm or red lead goggles. Even the person who is holding the patient, or in case of our case, that is the animal, must wear this lead gloves and lead apron while uh, taking the X-ray of the animal or while helping the to get the X-ray of the animal. Next is the radiation monitoring devices. There are certain devices through which we can able to monitor how much exposure one can get during the specific period of time. So uh, there are film badges that wear at the level of this belt below the apron to monitor the whole body exposure, and one is above the lead apron at the neckline to estimate the exposure of the skin of head, neck, and eye. And one important thing is the person who is less than 18 years of age should not be involved for or should not be employed for the radiological work, right? So, based on this, what a what a permissible dose one can get exposed in a year, that is to be calculated. So for that, this maximum permissible dose per year is equal to 5 rem into n minus 18. So if a person having age of suppose 20 years, right? So for 20 years person, if we put here 20 minus 18, that means 2, and it 10 rem radiation per year is a safe one. If he is getting exposure more than 10, then that is not safe for his future health. That will be harmful to him, right? So next one is a, now you see, so this one is the film badges that is wear above the apron at the neck level. This one is the film level, film badges that is wear below the apron at the belt level. And here this ring also. Then this lead goggles. This one is the lead apron, right? So this much safety devices or safety apparels we should use for the or the person who is working in the radiation with the radiation or taking the X-ray or radiographers who wear while taking the X-ray, right? So these uh, film batches after 3 or 4 month interval, we send to the BARC center, Bhava Research Institute Center. From there, they give the report on the written paper that this much exposure you get. So based on our age, we should calculate how much exposure is safe for me. If one get this more than the safety level of exposure, he should give a rest for a certain period of time. And during that time, one should employ the new employer, new person taking the radiograph. Then is principle of radiation therapy. That means how this ionizing radiation is useful for the treatment of cancer. That means cancer treatment, right? So for the cancer treatment, the radiation therapy is indicated only to that type of cancer who is localized one and solid type, right? And that is not excised completely. So surgically we cannot able to remove completely, and if the tumor is localized one and solid, then we should indicate this radiation therapy. And it is not indicated to that type of tumor or neoplasm that has a potential for high incidence of metastasis. Because if the any tumor is spread to the different organ of the body, then it is very difficult to expose the whole body with the radiation. So in that case, this radiation therapy is or radiotherapy is not indicated. Then radiation therapy is more effective in oxygenated cells. As we know that tumors is a highly vascularized part, and due to high vascularization, there is a more oxygenation in the tumoral cells as compared to the peripheral cells. And this radiation is very effective in damaging the oxygenated cells as compared to the less oxygenated cells. So this is the advantage of this radiation therapy to the tumor cells. Or disadvantage, we take this behavior of this tumor cells uh, is useful for us to destroy through the after bombardment with the radiation, right? And radiotherapy is not done by a single dose, but it is done in a multiple dose. Why we do in a multiple dose therapy? That will be clear from next slide. So few terms here I would like to discuss here is one is a therapeutic ratio. So it is the ratio of normal tissue tolerance dose to the radiation to the neoplasm lethal dose. On this basis or on the basis of this therapeutic ratio, we classify the tumor into three categories. First is a more sensitive one. Means more sensitive means having a higher or highest therapeutic ratio, and it requires less dose of radiation for the damage of the tumor cells. And under this category, the tumors that comes under this category is squamous cell carcinoma. Next one is a moderately sensitive one. Here the therapeutic ratio is 1. An example of this moderately sensitive tumor is mast cell neoplasm. Then the third one is a resistant one, radio resistant. Here the therapeutic ratio is less than 1. An example of this category of tumor is fibrosarcoma. So these are the principle of radiation therapy, and based on this principle, we go for radiation therapy of a tumor cells. So 4R principle of radiotherapy. 4R is first R is a reoxygenation, repopulation, redistribution, and repair. Reoxygenation means, as we know, the radiation is more efficient in damaging the oxygenated cells as compared to the less oxygenated cells. And as we know, the tumor is a highly vascularized one and highly oxygenated cells is there. That's why this radiation is more effective in damaging the tumorous cells as compared to the periphery of the normal cells. So once we give radiation dose, then more number of tumorous cells get damaged or destroyed as compared to the healthy cells, right? So oxygenated cells are more sensitive to radiation damage and are killed earlier and more. Uh, what happens is once the particular population of the tumor cells get killed, then the blood supply or oxygen supply is now available for the nearby cells or nearby tumor cells. So more oxygen is available to the hypoxic cells for further destruction. Hello. So that is a reoxygenation and repopulation. The ability of the neoplastic cell to divide is after radiation is slower as compared to the normal tissue, right? So that is a repopulation. And third one is redistribution. Once the as we know, the ability of the neoplastic cell to divide after radiation damage is less. So what happens is gradually the number of the tumor cells is decreasing and number of the healthy cells is increasing. So that is a redistribution. So the area that is affected with the tumor is get redistributed with the normal cells and tumor cells. And finally, at different stages of the treatment, gradually the tumor cells decreases and completely repair with the neoplastic cells. Now you see here. So this one is the red one is the tumor cells and this one is the healthy cells. So once we give a radiation or radiation therapy, more number of the tumor cells get damaged as compared to the healthy cells, right? And once they get damaged, the oxygen is available to the nearby cells or nearby tumor cells, and also the dividing capacity after irradiation, the dividing capacity of this tumor cells is less as compared to the healthy cells. So here the number of the tumor cells that is going to divide after irradiation is less, and whereas the normal cells is the dividing ability is more. So normal cells is gradually increasing, and finally this tumor cells completely destroyed, and that is the space is occupied by the normal cells. So this is the principle behind this radiotherapy. Then there are different techniques that is used for the radiation therapy. First one is the teletherapy. Teletherapy is a therapy in which the source of radiation is kept at a distance from the lesion, and under this there are three technique. One is a superficial X-ray therapy. Here, that is this division is based on the energy of the radiation that is used for the destruction of the tumor. Right? Superficial X-ray therapy. Here, the energy of the radiation, ionizing radiation, is 60 to 100 kilo electron volt. For deep X-ray therapy, the energy would be 200 to 300 kilo electron volt, and for super voltage therapy, the energy would be 20 to 100 mega electron volt, right? Then next one is a particulate beam therapy. Here, there is electron, neutron, proton beam can use for the therapy purpose. Then next one is a brachytherapy. Earlier one is a teletherapy where the source of radiation is kept at a distance from the target tissue. Here in brachytherapy, the source of radiation is in contact with the tumor cell. So here the therapeutic use of radioisotopes, that is implanted within the interstitium or on the surface of the neoplasm. So interstitial brachytherapy, here we use the gold and cobalt 60, gold 198. An advantage of interstitial brachytherapy is that the continuous irradiation of the neoplasm with a low dose of radiation, and low dose, very low dose is exposed to the surrounding normal tissue, and implantation requires a single anesthetic procedure. Then piezo surface brachytherapy. The source of radiation is used in contact with the surface of the neoplasm. Here we use strontium for the superficial lesion. Then systemic brachytherapy. For systemic brachytherapy, we use iodine 131 and phosphorus 32, and it is administered systemically, and it will attach to the target organ or at the tumor site, and gradually it start radiation, and it will help in damaging the tumor tissue. Next one is the what complication we get once we get the radiation damage with the radiation therapy, right? So there are two type of complication. One is immediate complication and latent complication. For immediate complication, that is observed within a minute or within a day, or within 24 hours, I think. Uh, and under this, there is you will observe the loss of hair, moist disformation of the skin erythema, and chromosomal aberration, hematological depression. Then latent complication, this complication you will observe within a month or a year, and under this type of complication, you will get observe this leukemia, cancer, lifespan shortening, lethal gene in the coming generation. So this is all about this class. So if you have any question, now you may ask.